Sue's story highlights the frustration that a daughter faced when her elderly mother was insensitively treated when admitted to hospital for something that appeared to be quite minor at the time, and how her treatment impacted on her and her family.
It all began on an ordinary Sunday afternoon. I had brought my 85-year-old mother to my place where she'd stay for afternoon tea and later a meal before going home. My mother has lived alone since the death of my father 14 years earlier. She asked me to look at her foot where she thought she had some problem. There between her smallest two toes on her right foot was a dry purplish opening in the skin. She has had diabetes for 30 years and consequently poor circulation in her feet. I was alarmed at possible implications and the following morning rang the podiatrist, who organised x-rays to ascertain if the infection had spread to the bone. We also saw her GP later that week, and with the wound not showing any obvious improvement, my mother was admitted into hospital for further investigations. Up to now, my mother did not seem too concerned and did not ask many questions, which is how she's approached her illnesses in the past. There was no contact from the doctor to family at any stage, and whenever I asked, my mother didn't know what was happening. I visited her most days, and on one of these visits, my mother told me that the doctor, when on the ward round, had in passing called out in a cheery way, "Now you'll have that toe taken off tomorrow, but don't worry, you won't miss it a bit." She thought he'd been joking. A nurse confirmed that her toe was indeed coming off tomorrow, at which my mother had become hysterical and the chaplain had to be called. My mother later said that it was the doctor's jocular manner and hearing the news in that way that had most distressed her. The next day, my mother went into surgery and had the toe removed. After several days, the staff talked to her about going home, but she just didn't feel ready and was feeling a lack of confidence in balancing and walking. I encouraged her to tell the doctor how she felt and that I would also contact the doctor. I was confident they would take this into account. Quite shortly after, though, a doctor from the ward rang me and said that my mother would be discharged the next day. There was no opportunity to negotiate. We both felt powerless and disregarded. I suggested that she come home to my house for a few days until she felt like going home. She was still traumatised by the events around the amputation and weakened by the surgery, with pain in her foot. My mother eventually returned home, and I spent most of each day there, assisting her with dressing, meals and the medication regime. The district nurse visited twice a week to regularly dress a foot that now had to heal an amputation and a wound. These dressings required the wound to be kept open and were painful, and my mother needed a morphine-based painkiller, which had some nasty side effects. The foot did not seem to be healing, and after 5 weeks of pain and disability, she was readmitted, and that's another story. What would have been patient-centred in this situation? Firstly, that both my mother and significant family members were communicated with clearly and proactively every step of the way. Secondly, that all staff understood the barriers to communication caused by my mother's deafness and took extra care. Thirdly, the news of the amputation could have been delivered in an appropriate way with compassion and concern about how she viewed this and time to adjust emotionally, and that the doctor took time to check that my mother fully understood and was therefore able to give full informed consent before surgery. Fourthly, that any discharge be fully cognizant of her morale and emotional state as well as her physical status, the well-being of the whole person and not just some case mix formula. Also, that the discharge planning be developed in a collaborative way with her major family caregivers who are also juggling commitments. Lastly, that the hospital follow up the patient after discharge, fully acknowledging this as part of their care obligations and seeking feedback on the hospital intervention and subsequent patient journey. All of these things would assist in placing the patient at the centre of the health intervention and assist medicine in reclaiming its heart.
Her experience raised a number of issues, including the importance of seeing the elderly patient as a member of a family and understanding the need to communicate with carers. The impact of poor and disrespectful communication and delivering important information unprofessionally. The impact of a lack of compassion and concern, and a disregard for the need for informed consent, and no consideration of the emotional impact of surgery and the patient's deafness. No discussion of the discharge plan with family carers, and also no follow-up care or seeking of feedback.
My own personal view of medicine is around the whole person. So I think when there's a reliance on the paperwork and the files and the tests and maybe the minimum amount of information to sort out the situation, perhaps there's good focus on some of the physical stuff, but to me that's not enough, because I know from when I've spent time with Mum, she has said to me, look, it's the little things that matter. And I've seen how getting even just a cup of tea at the right time that's actually pleasant and not stewed and cold actually helps her.